Hi, I'm Dr. Sonam Solanki. I'm a consultant pulmonologist with Bhatia Hospital, Masina Hospital, and Wokhad Hospital in Mumbai. The topic that we are going to discuss today is COVID-19 variants and its effect on vaccination strategies and health in patients. Now, when we do these COVID testing, we send it to the lab. WHO is doing active surveillance in seeing what are the strains that we are getting and whether we are getting any mutations in the virus genome or not. And based on clusters of these new mutations, you can predict or undergo active surveillance of whether there is any difference in the disease patterns or not. So there are variants of interest and there are variants of concern. When WHO identifies various variants of interest, they look and probe it further, and if they can correlate it with either more transmissibility, increased severity of the disease, or less effect to the current treatment options that we have, or less effect with the current vaccines that we are giving, then it becomes a variant of concern. So based on that, there are 4 to 5 variants of concern that the WHO has declared. And initially, the variants of concern like B117, B1351, P1, B16172. So these are the variants, and they were given names, allocated names based on the area with which they were identified, whether it is the UK, there's Brazil, India, etc. But now the WHO has made it a point to call these variants by a specifically assigned number like alpha, beta, gamma, and delta. And so that there is less panic, there is less social implications to calling a particular variant by a country's name. Now, currently we have the alpha variant. It has been reported since September 2020, and what it causes increased transmission, 50% increased transmission. There is increased severity, but the vaccines were found to be effective against this variant. There is the beta variant, which again there is a reported increased transmissibility, 50% increased transmission, and there are reports that some of the antibody cocktail treatment which has been given around the world is less effective against this variant. But the current ongoing vaccines that are available do have some amount of protection with this variant. The third variant, P1 or the gamma variant, again significantly reduced susceptibility to the antibody cocktail treatment that we had, and again some protection provided by the vaccine, but definitely reduced protection. Lastly, the topic of the hour is the Delta variant, which was reported by India initially and has been declared as variant of concern by the WHO in May 2021, which caused 40% more transmission, causes severe disease, reduced partially. There is some report, again this is very new and the data keeps changing, but there are reports of it having some reduction in the efficacy of the current vaccines that we have. What is the clinical significance of all these variants? Because the first question that comes to mind is that if there are variants which are not going to be effective to the current treatment, to the current vaccine, what is the point? So the first thing that I would like to highlight is that mutations is a part of the viral biology. Sometimes you get a weaker mutation which perishes on its own. Sometimes you get a stronger mutation which is clinically significant. Therefore, mask wearing, social distancing and hand washing is key. Isolating of the patients as soon as there are symptoms is important. So you never know whether they are infected with a variant, a mutant variation, or the original virus. So irrespective, we have to prevent spread of the virus. Aggressive vaccination is the key, and that is where we are all headed as a world, as a nation. And in the future, the vaccine productions and these companies may have to incorporate or take into account the variants that are found in the surveillance and tweak the vaccines accordingly. Or we are looking at some of us having to take the booster vaccine doses maybe in a year, but there is not enough evidence and data on that. As soon as we collect more data, the governments and WHO will come up with those recommendations.